Minnesota Department of Health Commissioner Jan Malcolm is retiring at what she calls an interesting time.
While the darkest days of the pandemic could be behind us, the virus is still with us. WCCO's Erin Hassanzadeh discussed the current state of COVID-19 and the current state of our healthcare system with the woman who saw it all up close.
Commissioner Jan Malcolm is heading into retirement at a time when health care in our state appears to be strained.
Well, I think some of the things that we're seeing now have been pressures that have been building for quite a while in health care.
The state of our healthcare system feels fractured. Everyone has been watching nurses going on strike, hospitals constantly saying they don't have enough resources, care that is extremely expensive. So people are thinking, what gives?
We've lost a lot of people in healthcare and in public health. The pandemic really made it much, much worse and sort of revealed how disconnected the parts of the system are.
She says the years-long pandemic left scars and exposed fractures that still need healing.
Whether it's kids or adolescents or people who've have ongoing health challenges or have lost people or have lost their businesses, there's just a lot of healing to do, and we really need to not gloss over that.
On her way out, the commissioner is still pushing Minnesotans to get the COVID vaccine. Just over 70% of Minnesotans have received at least one dose.
We've got 500 people every day in the hospital with COVID. Now the priority is helping people stay up to date because we've got a lot more people who got the initial shots and only about half of those have gotten the boosters.
And it's still not too late to get a flu shot.
Why didn't people get their flu shots this year?
That's a great question. It seems like it could be just sort of that overall fatigue with all things illness related and fatigue with immunizations.
What are the new challenges for the next commissioner?
I think some of it is just sort of the recovery phase of, for us as an agency, as the public health and healthcare fields that have just really struggled with the burdens of the work over the last few years. We've kind of squeezed all the surge capacity out of the system over time, and we need to figure out how to build some of that back in.
Yeah. And for once, it will be someone else's conversation to have.
Yeah, well, I hope to still contribute.
Erin Hassanzadeh, WCCO 4 News.